In today's episode, we'll delve into ransomware and the critical role healthcare defenders play in cyber resilience. So think of the SOC team, the Security Operations Center, the security analysts. These are the healthcare defenders, and it's their role in cyber resilience we're going to be going into today. As we're all aware, healthcare and life sciences organizations worldwide are being disrupted by ransomware. And this is degrading the quality of patient care. In a worst case, it's even causing patient safety issues. Unfortunately, ransomware attacks are likely to increase in speed, scale, and sophistication as attackers are increasingly using AI. In the recently published Microsoft Digital Defense Report for 2025, you can read how attackers are now using AI for automated vulnerability discovery, phishing, malware, deepfakes, and even social engineering. We'll include a link below to this report. I highly recommend check it out. Now, a key question to frame this discussion is what steps can healthcare defenders take to enable their organizations to be cyber resilient so that when ransomware strikes, unfortunately, not if, when ransomware strikes, they're able to recover quickly with confidence, minimize disruptions, and avoid having to pay the ransom. I'm excited to have two industry leading experts join our conversation today to share their insights and expertise. Chuck Christian, VP of Technology and CTO at Franciscan Health, and Josh Howell, Healthcare CTO at Rubrik. Welcome, Chuck and Josh. To start the discussion, Chuck, we'd welcome your perspectives from the front lines of healthcare on the top risks you see and strategies you're using to address these.
Well, I mean, cyber resiliency, it's never you're never done. It's something that we're going to have to continue to do forever. As every time that we think that we've got all the mouse holes closed up, comes a smaller mouse. And now with AI coming on board, I think one of the things that keep me up at night is that our AI is going to have to be smarter than their AI. And the one thing that there was a gentleman told me a long time ago that the hackers only have to be correct once. We have to be correct every time. So it's not a matter of if, it's a matter of when. And so I think it's a matter of the tool sets. There's not one broad ranging tool that you can use to protect the entire organization. Franciscan Health is 12, 13 hospitals depending upon how you want to count them. We have about 400 different locations, physician practices. And so our attack vectors and surfaces are broad. The last time I checked, we have over 100,000 devices connected to our network. And so there's 100,000 opportunities that we have to protect each and every day. So we're choosing the tool sets that we need in order to look at a multi-factor approach to security, and trying to build our network so it is a zero trust uh, instrument, and all of our technology on the infrastructure side. We consider that a security opportunity as well.
Thank you, Chuck. Great points and super interesting. I think in some ways the actual healthcare workers, the clinicians, the doctors, nurses are on the front lines in a sense that they're going to be subject to phishing and even spear phishing at scale with attackers using AI. And it seems like we need to take a three-prong approach, right? We need to prevent, clicks on emails and that are phishing emails and so forth. But we need to continuously monitor because at some point that click's going to happen. To your point, it's a when, not an if, especially with the more sophisticated phishing and spear phishing. So the continuous monitoring and the remediation, like when something's detected, somebody clicked. What do we do? Like you talked about tooling being really important. I'd love your perspective on like how you're thinking about monitoring and response, including remediation and cyber resiliency. If you can comment on that.
Well, you don't sleep a whole lot when you start thinking about that kind of stuff. I mean, I think that our security team does an outstanding job at education. I get all kinds of uh, documentation about, and the topic is protect Franciscan. And that the tone of that is that it's not just security's job or infrastructure's job to protect the organization, it's everybody's job. And you're absolutely correct, David, is that the phishing campaigns are getting far more sophisticated. Some of the stuff that I see that comes through, I've been doing this for a very, very long time, as you can tell from my lack of hair, is that it requires me taking a hard look at it to say, and I'll go ahead and turn it in as phishing, even if if I can't tell, it goes into the fishing pot, and then I'll let the team look at that. But you're still going to have those people that are hurrying through their day, and they're going to click on something they're not going to think about. And so you have to have the tools in place that will help catch that and warn and give us an opportunity to respond before it goes through, through sandboxing and a whole bunch of other opportunities. I'm not going to give away all of our tricks and techniques because it's kind of like giving somebody the combination to the safe. But there is a lot of different ways that we can adjust and make sure that we're not going to do something that would be foolish. But one of the things that we've seen that if we have our phishing campaigns we do internally, you'd be really surprised who clicks on those links. I had one over the weekend that, man, it really looked real. And fortunately, I went ahead and turned it in, and I got the banner that says, "Congratulations, you've successfully passed the phishing attempt this month." So I don't have to go to school. So that always makes me happy.
Thank you, Chuck. So many great points, and so important that the frontline workers are familiar and that they embrace that security is everyone's job, right? Not just the job of the security team, and they become familiar with recognizing these emails and not clicking. Unfortunately, the emails we used to recognize them by the poor grammar.
Yeah.
Gone are those days, right? The AIs that the attackers are using can craft emails that maybe even better grammar than a human could do offhand. So I think the challenge is definitely there. And one last question for you in terms of integration of solutions. Like as you're thinking of your security analysts doing the monitoring, the detection, the response, remediation, what importance would you put on integration of tools? Thinking of them, multiple dashboards potentially, potentially missing something if there's too many dashboards is like I know a lot of organizations have sort of grown their security in a sort of best in class strategy, and they may not necessarily have the integration. Any thoughts on integration?
Well, I think that, there's 2 schools of thoughts, is that, we were, a best of breed shop and moved to more of a centralized, and, as we moved Epic to Azure, last year, and so we've, kinda standardized on a lot of those tools. We have a significant investment in the Office 365 suite, both on the workforce side of things and the security side of things as well. And I think we have just about every tool that Microsoft offers that we're utilizing, but we also have a list of others. And if you really know what that list is, you'd have to talk to the security team because they have that catalog. But at the end of the day, is one of the things we have to worry about is, from the resiliency, is there's recoverability and how rapidly you can recover from that. And those are the tool sets that we try to use. And we've recently, and your next guest is going to talk a little bit about their tool sets, which we've adopted, which is Rubrik. And we're moving more and more of our assets into in their vault because some of the just because you can recover from it doesn't mean that you're not recovering something terrible they've been around for a very long time and you've backed them up, and so now you're recovering it. So some of their tools that they have in order to do the threat analysis as you're recovering those to know, exactly when was the best last backup that you've had. But there's also some tools around identity management that we're working on getting implemented so we can recover our Active Directory environment at a very rapid pace rather than going through trying to rebuild a forest, which is not an easy task, but being able to put it back very quickly. And so I think what you have to do is be smart about the tools and things that are applicable to your environment. Because if you've seen one environment, you've seen one environment, and ours looks differently because of the way that we've created it over time. And we still have assets on prem in our data centers, as well as what is in the cloud. And so we have to protect both equally because those are our crown jewels.
Thanks, Chuck. So many excellent points, and we greatly value your perspective in helping us ground the conversation and align on top priorities and strategies. Now, Josh, from your role as healthcare CTO at Rubrik, you're no doubt getting global perspective on how ransomware is impacting healthcare organizations of all kinds and sizes worldwide. What are the key capabilities you see that are required to improve cyber resilience of these organizations?
Yeah, David, to start with, just the pace of attacks is off the charts. So we've seen something like 130 health systems hit in a 90-day period. So the DR events of the past that were rarely invoked, but every organization spent money on preparing for those. Now we have threats that are both super high impact and very likely. So as Chuck said, it's not a matter of if, but when. And one of the things that I'm really cognizant of is how often there's a disparity in learning effects where the attackers, unhampered by lawyers or legal restrictions, are able to share knowledge freely. And in many cases, they've been able to learn from 20, 30 previous attacks where often the defenders that we are working with, this is their first exposure to a ransomware attack. And so that's one of our missions at Rubrik, is to help with that knowledge sharing and try and help as many organizations as possible come to terms with the emerging body of knowledge of how these recoveries are conducted. And as Chuck pointed out, there's a lot that goes into it. It's not a matter of if you can restore your data, although too often claims of immutability are being proven false. I think right now the average is about 74% of attacks, the backups are at least partially destroyed or damaged. So that's why we place such a big emphasis on immutability all the way down through the hardware layer, and we try and control that entire stack. Is that shouldn't be a problem if you have the right platform. But then knowing what to expect in the immediate aftermath of an attack, just preparing yourself for the all encompassing effects of everything being offline, either as a result of the attack or that the defenders took it offline in an attempt to contain the spread, disconnecting from the internet, the loss of pretty much all of your SaaS applications, at least for a time, and then needing to work your way out of that hole, knowing that if you restore the wrong things into your isolated recovery environment, you get to start all over again. And so that ability to really understand what changed in Active Directory and Entra, what malware could exist in your backup data, and bring all of it together in a single context. So, as Chuck talked about, there are a lot of tools. There's no shortage of tools. Every team has a plethora of tools that they turn to, but how do we create shared context? If you are a network administrator, how do we get the right data and context into, say, your Cisco tools? If you're part of a CISO's organization, how do we feed the right data into, say, a CrowdStrike or a Splunk tool? How do we feed the right data into the Windows the Microsoft security tooling? So that's really one of our focuses, is bringing all of the right context so that decision makers and leaders can move at the pace that their teams are able to, with fewer meetings, because it's really hard to coordinate in the immediate aftermath of an attack.
Josh, so many great points. And the one that really stood out for me is when the ransomware incident occurs, it's so important for people inside the healthcare organization, the SOC team, but it's a group effort. There's many different teams that'll be touched, but it's so important that they operate quickly and with purpose, and it's well sort of choreographed, if you will. So I think a very important part of that is that your cyber resilience is not just a placebo. It's real. Like, you have the ability to restore quickly with confidence. And you were talking about Ransomware likes to get into the backups, right? They want to remove your ability to restore, so you have to pay the ransom. And I've heard from CISOs and healthcare organizations as well that if they pick the latest restore point, they restore. It might take a day to stand everything up, and then they discover that what they've restored actually has the malware in it or encrypted data. They got to start again. That kind of iterative cycle will really lengthen the time of disruption of healthcare, right? Any further thoughts on that? Like, how would you, aside from just testing your backup and restore, how would you make sure that what is in that cyber resilience image you're restoring from is clean?
Yeah, so I'm a fan of saying, doing the slow thinking now enables you to take fast action later. So there is a lot that healthcare organizations can do to prepare now, how they rehearse, how they work together, the tool sets that they adopt that enables them to move rapidly through that recovery process. One of our folks uses the analogy of a deck of cards. In the end, you're going to end up recovering all of your data. M365, Exchange data, SharePoint, OneDrive, Teams, all of your file shares, all of your databases, your virtual servers, all of that is going to need to be replaced and recovered into an isolated recovery environment or back into production eventually. And if you flip a wrong card out of the 52 cards you have face down, you get to start all over again. And if you flip a joker, you get to start all over again. And so what Rubrik is delivering is the ability, think of it as X-ray vision, to see what's behind all of those cards before you start flipping cards over. And so that's where we have an element of introspection into the backup data, where, say, Chuck's team, when they're working with an incident response vendor, they can take that indicator of compromise list, hash values, Yara rules, file patterns, and just copy and paste into the backup interfaces and hit go, and we return results really quickly that within the backup data, these are the virtual machines or file shares or files you don't want to recover. And this allows you then to move at a much faster pace, knowing you have a greater confidence of being able to recover clean data, what applications and systems were unaffected, and which ones perhaps need to be put into a clean room for manual cleaning if the data is sufficiently important and freshness matters. You can go ahead and manually clean that data. The important thing is that you have a plan for every step in the process. How are you going to communicate in the immediate aftermath? That you have low tech, out of band, maybe old conference bridge style lines that have been communicated to everybody, that the sets of tools you're going to use are impervious to attackers who have been behind your firewall for weeks, perhaps with domain admin credentials, that you know how to recover Active Directory and Entra into an isolated recovery environment, restore those app registrations to get things back online. Very little works without Active Directory. Getting M365 back online quickly is a key factor in being able to coordinate and collaborate in your response. I can't tell you the number of immersive ransomware experiences that I've led for organizations where, after debate, they arrive at M365 may actually be of higher priority of recovery than, say, Epic, just because it's how everything is going to be discussed and the collaboration of the recovery is going to happen. And then being able to recover basic underlying infrastructure services like Active Directory and Entra into that IRE, and then start through the list of prioritized applications and do it in a way that's safe. If you can sprint through that process, if you have a plan for it and you do the slow thinking now, where are we going to recover to? What tools are we going to use? You're out ahead of majority of the organizations that are responding to ransomware these days.
Great to hear, Josh. Thank you for that. And again, so many excellent points. So picture the healthcare defenders watching this video and they're wondering, like, how do we get started? Like, what would you recommend? Where should they go first to learn how they can become more cyber resilient?
Yeah, so we have an immersive ransomware experience. We call it 0 Hour in Healthcare. It's not a Rubrik pitch, nothing about Rubrik. It's not even that technical. We routinely have board members, chief medical information officers, chief nursing officers, people from facilities, supply chain attend. They grasp all of the content. But we really walk through over a couple hours what it's like to live through one of these attacks, focused on the regulatory, legal, clinical impacts, etc. And I think that's a really good way to come together as a team and develop a shared understanding and shared vocabulary of what responding to one of these attacks is like. And our goal is that everybody walks away with at least one thing they can do differently in preparation. So, for instance, do you have a list of all of the key vendors and relationships that you'll need to reach out to conduct your recovery? And is that whitelisted with your legal team? Just simple steps like that. They're non technical, they don't cost any money, but boy, they can really help speed up your recovery. So, always feel free to reach out to the Microsoft team or the Rubrik team. It's a complimentary engagement, and we never really talk about Rubrik.
Josh, thank you. That sounds like an amazing opportunity, and it could really help people get that sort of firsthand perspective of how do things look during an actual incident, and that can inform their sort of incident response plans and tabletop exercises and all kinds of downstream capabilities. So thank you again, Josh. Excellent recommendations. As Chuck and Josh shared, ransomware is a top threat and risk facing all healthcare and life sciences organizations worldwide. But with the right focus, strategies, and capabilities for cyber resilience, healthcare defenders can conquer this challenge. Thank you, everyone, for tuning in, and special thanks to Chuck and Josh for joining us. Stay tuned for our next episode, where we'll learn more about how to combat the threat of ransomware, including prevention, detection, response, and remediation. So, together, we can minimize the impacts and risks of disruptions and enable the best quality patient care.